Well, hello everyone, and thank you for joining us today, and welcome to Ecolab's webinar on best practices for resuming operations in long-term care communities. While most of you probably never shut down completely, we know that depending on the type of care you provide, the state you are in, and the rate of infection surrounding your community, you are likely in different phases of resuming things like move-ins, allowing visitors, or reopening dining areas. Today we are here to discuss heightened sanitation procedures and best practices that you can apply to maintain healthy environments and instill confidence in residents, visitors, and employees, no matter where you are at in the process of resuming operations. So just a couple of quick housekeeping things that we'd like to cover. Please use the Q&A the Q&A feature at the bottom of the webinar to ask questions throughout the presentation. Our presentation and a recording of this session will both be available on the Ecolab Long-Term Care COVID-19 Resource Library within a few days. A link will be sent out to attendees once these are available. Spanish translations for both the presentation and the recording will also be available on Ecolab's Resource Library in the next couple of weeks. For those pursuing continuing education credit, at the end of the presentation, there will be a question with an option to request a certificate of attendance. And now, so before we get into this, we're going to kind of get into the meat of it. It's going to be a little technical. I just want to address the human element of this. So we know with COVID-19, these really are unprecedented times, and there are some very real challenges that everyone's facing. I just want to tell everyone, everyone here at Ecolab that's involved with long-term care is really personally invested in helping our customers, frontline workers, and residents to be as safe as possible through this time. For us, it's personal. I know I have relatives that are in long-term care facilities, and so it's a challenging time. We're here to support you. So with that, I want to introduce our speakers for today. So today we'll have two speakers. It's Alexis and Ben. So Alexis has been with Ecolab for 8 years. During that time, she's developed a strong focus on long-term care and senior living industries, along with our environmental and hand hygiene program offerings. She has led the development of training programs and procedures and helped tailor our COVID-19 response materials and tools to the needs of our long-term care customers. Alexis holds an MBA from the Kellogg School of Management. Our other speaker is going to be Ben Conway. Ben has over 12 years of RD&E experience at Ecolab. In his current role, he provides technical expertise to long-term care, global lodging, global marine, and government sales customers, and has taken a primary role in consulting on product and procedure recommendations related to COVID-19. He has a BS in biochemistry and a master's in technology management. With that, I will hand it over to Alexis.
Great. Thank you very much, Caleb. So I want to start, if we can move to the next slide, I want to start by really echoing Caleb's sentiment and just saying thank you from all of us. We know that the senior living and long-term care industries are facing much more than just the economic or business impact of all of this, but really an impact on the health, lives, and well-being of your residents. So we know that this hasn't been easy and that you are all continuing to do the best you can to care for your residents and create clean, safe, and healthy environments. And we appreciate you taking the time today to join us for this out of your busy schedules. We know the pace and magnitude of changes over the last 6 months has really been unlike anything that most of us have seen in our lifetimes. There are really more than what I can list, but I do want to call out a few key changes to needs that we're seeing that are really impacting the dining and environmental hygiene operations. So first, starting with dining, we know that you've seen shifts in your operations, potentially doing in-room meal delivery, limiting your dining spaces, shifting hours, changing setups for social distancing, and this has really impacted the way that you and your staff are operating. Of course, any of the decisions that you're making probably come in finding a balance between really protecting the physical health of your residents and also finding ways to protect their mental and emotional health, as we know that engagement and isolation can really be concerns during this time. So certainly something that's impactful as you're deciding how and when to open up and what activities to consider in your communities. As a part of that, we know that not only increased cleaning and disinfection, increasing the frequency, but also making that more visible is a big part of that. So it's not just about cleaning for appearance, but cleaning for health. And really letting people see what's happening there. People want to know that that cleaning is taking place, that disinfection of high touch points is happening frequently. And with all of this, it's really a shift in the way that you're operating. So we know that it comes with training, both increased training for current employees on new procedures, training for new employees, as certainly we know labor is a massive challenge in this space as well. And with all of this operational changes, increased costs, we know that that need for operational efficiency is even stronger than before, and so we hope to really address that today. So with that, I'll get into our agenda. So I will start by taking you through some considerations as you prepare for resuming operations, which are also applicable just as you're continuing on normal operations as well. Then I'll hand it over to Ben, who will take you through some tips on safeguarding employees and really things that you can do to help focus on their health, and then go through best practices around environmental hygiene and food safety for your operation, including some resident assurance tactics. And then we will wrap it up at the end with plenty of time for Q&A. So I just remind you to please feel free to submit questions at any time by typing them into that question section of your screen. All right, so diving into resuming operations, if we could go to the next slide, please. So as you're thinking about this, it's really important to understand the risk factors. We know that the risk of COVID-19 will remain until there's a viable vaccination or antiviral treatment of some sort. And so the first consideration is really how can this enter your community? And one aspect of that is, of course, your staff and employees. So we know that it's not just about what they're doing in the community, but also what they're doing in their personal lives and outside of work that impacts that. As some best practices, we know we've seen some companies having their employees sign pledges and really focusing on making sure that they are taking additional precautions outside of the workplace as well. Additionally, a study by UCLA suggested that eliminating cross-traffic between nursing homes could have reduced COVID-19 infections by 44%. So it's a really, really impactful risk factor. The other consideration, of course, is your residents and their visitors. So as you're considering whether you have already or will in the future be opening back up to visitors or to admitting new residents, just making sure that you have really clear screening protocols in place for these and set expectations appropriately and communicate those out to those respective parties. And state guidance as well as the CDC and CMS have some really great recommendations for these. As you're all likely aware, the virus is transmitted between people through virus-laden respiratory droplets. That's why face masks are so important and recommended by the CDC. Of course, these droplets can also contaminate environmental surfaces, which transfer to a person through the mouth, nose, or eyes. So this is why both surface disinfection and hand washing is such an important focus as well. To that point, we'll see on the next slide, in 30 minutes, the average person touches 300 surfaces. So just some something to think about in terms of how rapidly something like this can spread and why that focus is so important. So as we move to the next slide, I'm hoping that most of you on this call are really familiar with a lot of these measures, but as we think about some of the basics on implementing enhanced hygiene, really it starts with hand washing, making sure that you're washing with soap and water, and when that's not available, using an alcohol-based hand sanitizer, taking steps to minimize close contact, social distancing, and masks, and then ensuring proper use of personal protective equipment where appropriate. The second piece to that, beyond the personal hygiene pieces then, is that environmental hygiene I mentioned. So really that cleaning and disinfection specifically focused on high-touch surfaces. So to that point on high-touch surfaces, just something to consider, these all differ in your different areas and from community to community, but really thinking about what are the areas that are most often being touched by residents and staff, especially things that are being touched by staff from room to room, common areas, thinking about the tables and chairs in between dining services, things like that. So just thinking about those most common vectors for transmission. So with that, I will turn it over to Ben to talk a little bit more about safeguarding your staff.
Thank you, Alexis, and thank you all for joining us for this webinar. So how can we safeguard your employees? When developing your plan to safeguard employees, there are many considerations, from ensuring they're educated on symptoms of COVID-19 and how they will be monitored, to how to properly disinfect personal items to minimize any potential spread of the virus. This plan will ensure that as a business ramps up, you have sufficient healthy employees to staff the operation. So next we'll talk about how to promote infection prevention. So it's important to ensure employees understand proper infection prevention measures, such as covering their mouth, nose when coughing or sneezing, and disposal of soiled tissue in proper waste containers, to staying home, and whom to contact if they are ill. These are considerations above and beyond the personal hygiene measures previously discussed, like washing hands often and correctly, and avoid any unnecessary physical contact with other employees or guests. So hands as Alexis mentioned, hands are the primary mode of transmission, so hygiene must be implemented before and after a shift or break, after using the restroom, cleaning or attending to a resident, before eating, and before and after the use of PPE. Proper hand hygiene with soap and water is critical. For those instances where soap and water are unavailable, it will be important to offer hand sanitizer for employees, residents, and visitors, especially in high-traffic areas. While your employees are aware of the importance of this, it may be beneficial to make family and visitors familiar with this process. Recommend making it a part of their entering process. On our resource library, there is a printable chart with this information available on long-term care COVID resource library or .com page. Links will be provided. So proper hand hygiene should also be used in conjunction with proper gloving techniques, which we'll discuss next. So you may have new staff members wearing gloves more often who are not used to wearing gloves. Follow CDC guidance along with local and federal regulations when considering appropriate PPE to be worn by employees, residents, or visitors. Currently, CDC recommends that everyone should wear a face cover when they're in public. Additionally, throughout many areas of operation, the new normal may be to wear gloves. Make sure your staff feels comfortable properly putting on and taking off gloves, inclusive of the hand hygiene steps. So Many states require staff to wear a face mask and maintain 6 feet from each other. The masks are meant to protect others in case of infection. However, it is important to note that masks are not meant to be a substitute for physical or social distancing. Cloth face masks are not a surgical mask, nor an N95 respirator, So according to the CDC, these are critical supplies and should be reserved for healthcare professionals. Avoid touching the face mask throughout the day to prevent contamination. Best practice is to keep over the nose and mouth. Additional guidance on face masks can be found on the CDC website. So now let's dive into environmental hygiene. Well, Ecolab has always provided best practices of cleaning and disinfection throughout an operation. A behavior shift at the unit level may be required to ensure that employees understand and explicitly follow proper environmental hygiene procedures. Best practices we will discuss today are meant to reinforce the importance of not only selecting the proper solution for the job, example, product, tool, and application method, but also that even the best tool available, the overall procedures are critical to ensure that you can return to operation quickly and with a peace of mind that you've done everything you can to protect your employees, residents, and visitors. Next, we'll set the groundwork for cleaning and disinfection. As we discussed previously, there may be various products used to achieve environmental hygiene. They each have a different job. I thought I'd ground us by describing the differences. So a cleaner helps remove soils such as food particles, dirt, or other impurities from the surface. Historically, a sanitizer reduces but does not necessarily eliminate the amount of bacteria on an inanimate surface significantly and didn't carry much for claims on viruses. Of course, there are some unique circumstances where emerging pathogen claim can be pursued for sanitizers. EVP claims, or emerging viral pathogen claims, are intended to provide proof of efficacy on newly discovered viruses where no test has been developed, for example, COVID-19 previously. Later, I'll provide an example of a groundbreaking innovation that holds this EVP claim at food contact sanitation concentrations and enables a more efficient operation. So now we're talking about a disinfectant. A disinfectant used on hard, non-porous surfaces and objects to destroy or irreversibly inactivate infectious bacteria and viruses. This would be the type of product necessary to address concerns around COVID-19. Both surface sanitizers and disinfectants are regulated by the EPA and are used to manage public health risk. Always ensure that your staff use these products following label directions. And the disclaimer is, which should hopefully be obvious to everyone, but surface sanitizers and disinfectants are not for use on humans or animals. As of July 30th, 32 states have authorized indoor visits. Majority are outdoor only, though a few allow indoor visits. Some states open up senior living visits earlier than skilled nursing. The CMS guidelines urge nursing homes to continue barring any visitation until they have gone at least 28 days without a new COVID-19 case originating on-site, as opposed to a facility admitting a coronavirus patient from a hospital. They should meet several additional benchmarks according to federal agencies, which include a decline in cases in the surrounding community, the ability to provide all residents with a baseline COVID-19 test and all staff with weekly tests, adequate supplies of personal protective equipment and cleaning and disinfection products, and no staff shortages. As communities begin to open their doors to visitors, cleaning and disinfection frequency should increase. You should also consider and document frequency of cleaning and disinfection in your reopening plans. This is a decision that could be made at the unit level or mandated from a corporate level, but regardless, it should be reevaluated as environmental variables change. As infectious infection risk, foot traffic, and soil load increases, so should the frequency of cleaning and disinfection. Translated, it simply means when you reopen functions of your communities, i.e. dining rooms, and additional visitors, the infection risk may be higher. This requires an elevation of standard operation procedures pre-COVID to understand that they are appropriate to protect your employees and residents and visitors. Likely you want to employ a more frequent cleaning and disinfection until the risk begins to subside. So understanding the importance of disinfection on non-food contact surfaces and the proper procedures related to it. There are several steps to using a disinfectant properly. A pre-clean step may be required if there is visible soil as food or dirt, or such as food or dirt. The disinfectant can be applied according to labeled directions, either by spraying, through immersion, using a mop cloth. Most critical step to achieving disinfection is step 3, wait. This is an example of how important it is to let the tool do its job. In this case, the tool is the disinfectant. You only achieve disinfection when the treated surface remains wet for the contact time listed on the product label. If you are unsure, reach out to your chemical provider to obtain that information. This is where you need to understand the required contact times, sometimes referred to as kill times or dwell times. Finally, wipe the surface or allow to air dry. I'll note that the order of actually clean, removing the soil from the surface, is important to wipe. So next we'll talk about food contact surfaces. Disinfecting food contact surfaces. This procedure should only be used during outbreak situations. The most important call out here is that you follow standard disinfection procedures reviewed previously, except for now the food contact surface should be rinsed with potable water and sanitized using food contact sanitizer. This is an important distinction because many products are too strong at disinfection levels to be considered appropriate for food contact. So as we investigate new and innovative ways to disinfect spaces to ensure health and safety of your residents, staff, and visitors who may enter your communities, I thought it would be important to provide details on a few application types and best practices and procedures when using an electrostatic sprayer. There are various ways to apply a product: through a manual trigger sprayer application, using a pressure sprayer, similar to something you may use to apply traditional pesticides like a weed killer, or even electrostatic spraying. These devices apply an electric charge to liquid particles, causing the droplets to be attracted to surfaces. This allows for more uniform and comprehensive coverage of surfaces. There are some special considerations when using electrostatic sprayer. For example, ensuring the internal components are compatible with the chemistry, that the proper nozzle size is utilized and PPE is worn, and that surfaces are sprayed from a distance no greater than 2 feet. If you plan on applying your chemistry using this method, please contact your Ecolab representative for a list of recommended products. Now, how about some do's and don'ts for electrostatic spraying? I'll save you all from me reading this list. However, I'd like to point out a few more important do's and don'ts when using electrostatic sprayer. So for do's, ensure no bystanders are present. Ensure there is proper ventilation, wear proper PPE, and allow at least 15 minutes for air to settle before re-entering. Now for don'ts, don't spray flammable products. Don't spray electronic or sensitive items unless confirmed to be okay by manufacturer. This should be extremely obvious to everyone, but please do not spray people or animals. Don't use this to treat the air. This was not intended. This is not the intended use of the device and does not have registration for that application. It is also worth mentioning we have a comprehensive step-by-step procedure guide for electrostatic spraying, which can be found in our resource library or from your Ecolab rep. So continuing with the theme of innovative ways to clean and reduce pathogen risk. The next slide is an example I alluded to earlier when talking about food contact sanitizers with EDP claims. So Smart Power Sink and Surface Cleaner Sanitizer is an EPA-registered food contact cleaner and sanitizer with emerging viral pathogens claim at food contact sanitizing concentrations with an astounding 30-second contact or dwell time, which also includes norovirus claim with that same contact time. Especially during these unprecedented times, there is need to streamline processes and procedures of cleaning and eliminating pathogen risk on food contact surfaces, allowing you to complete process in 2 steps versus 3 previously described, enabling you to be more efficient while being compliant with food and health code. So now that we've touched on hard surface applications, we'll transition over to soft surfaces. One question that keeps coming up over the course of the last few weeks has been about cleaning soft or porous surfaces such as upholstery or drapes. Early research has demonstrated that this virus may not be viable for, or may only be viable for 24 hours on a soft surface. That soft surface used in the study was cardboard. So implying that there are many, many pores within cardboard. With this in mind, the following protocol is recommended by the CDC for handling soft surfaces. Either remove visibly contaminated or remove visible contamination and clean the surface using soap and water or with a cleaner appropriate for use of this surface type, or launder items if possible, according to the manufacturer's instructions. We'll discuss laundry best practices shortly. So without further ado, I'll dive into some best environmental hygiene practices across your operation. So starting with public areas, focus disinfection on high touch point or high touch hard non-porous surfaces, ensuring treated surfaces remain wet for proper contact time. Disinfection should be most frequent in public areas, especially those with high traffic. Currently, the CDC recommends these areas are disinfected multiple times per day at minimum. Risk factors in here and your operations may opt to disinfect more often. Disinfect surfaces after each guest interaction and offer hand sanitizer for instances when soap and water is not available. Consider providing disinfectant cloths and or disinfecting wipes for use by staff throughout your facility. Other considerations are markings on floor to encourage social distancing and signage for proper PPE. Restrooms are the next space we'll dig into. So if not allowing visitors in the building, you may want to consider shutting down public restrooms altogether. This will help ensure you're spending those resources where needed most. Some best practices for public restrooms are to ensure that hand soap is sufficiently stocked and paper towels and hand dryers are available. Frequently disinfect hard non-porous surfaces throughout the day, including high touch point objects like doors, stalls, and latches. Consider posting clean schedule in a public viewing and employ a bathroom cleaner disinfectant approved for use against COVID-19. Now, how about resident rooms? Staff may be cutting back on daily housekeeping activities. So for that, focus on disinfection of high-touch, hard non-porous surfaces, ensuring treated surfaces remain wet for the proper contact time. Employ a bathroom cleaner disinfectant approved for use against COVID-19, or address high-touch surfaces as a secondary step using disinfectant that is approved against COVID-19. Remove dishes and or glassware to be sanitized outside the room and offer single-use items as an option. Laundry is the next space we'll spend some time discussing. Provide disposable gloves, soap for washing hands, and an EPA-registered disinfectant for residents and workers to clean and disinfect buttons, knobs, and handles of laundry machines, laundry baskets, and shared items. Post guidelines for doing laundry, such as washing instructions and handling of dirty laundry. If offering laundry collection, collect laundry with minimum agitation and prevent unintentional contact with skin or uniform. Consider bagging dirty linen in resident rooms and avoid leaning into the cart when gathering the laundry. Consider a one-directional flow of the laundry room to reduce contamination of clean linen. Washing with Ecolab detergent using existing formulas and sufficient drying results in hygienically clean linens, which is defined as free of pathogens in sufficient numbers to cause human illness. According to the CDC, dirty laundry from an ill person can be washed with other people's items and still achieve hygienically clean linen. Disinfect hampers, carts, washers, seal and rim, and machine door handles and buttons. Maintain access and adequate supplies to laundry facilities. Restrict the number of people allowed in the laundry room at one time to ensure everyone can stay at least 6 feet apart. Now we'll move over to food service. The CDC recommends to restrict the number of people allowed in a kitchen and dining room at one time so that everyone can stay at least 6 feet apart from one another. And people who are sick, their household members, and those who have higher risk of severe illness from COVID-19 should have prepared meals delivered to and eaten in their resident rooms if possible. Disinfect high-touch non-food contact surfaces frequently. Train staff on proper hand hygiene protocols, PPE use, and cleaning procedures for food contact versus non-food contact surfaces. Minimize items offered on tables and disinfect any of the remaining items between resident usage, i.e. menus, condiments, etc. Encourage social physical distance by spreading out the tables and encouraging staff to minimize use of high traffic areas. Consider the addition of knock and drop or in-room dining offerings. Eliminate any standing water or food debris to prevent pest activity. And then some other considerations are using prepackaged foods or grab-and-go type of items. So how about food delivery guidance? According to the FDA, currently there is no evidence of food or food packaging being associated with transmission of COVID-19. Provide personal protective equipment, for example, gloves, gowns, masks, etc., as directed by local and federal authorities for employees. Train staff on proper hand hygiene protocols, PPE use, and cleaning procedures for food contact versus non-food contact surfaces. Keep hand sanitizer on a cart when the hand washing sink is unavailable. Keep cleaning product, disinfectant, and paper towels available on a cart for cleaning and disinfection of the cart and other high-touch surfaces. Increase frequency of cleaning and disinfection of high-touch hard surfaces, and consider offering a no-contact delivery option, which means orders can be delivered by a designated staff member. So now we can jump over to the back of the house or the kitchen area. So again, focusing disinfection on those high-touch non-food contact surfaces, particularly in high-traffic areas, by these stove, ovens, and other highly used utilities. Hand washing stations and hand sanitizers should be conveniently and highly visible. Train staff on proper hand hygiene, use of PPE and procedures for food contact versus non-food contact surfaces, and what those are. Ensure physical distancing of employees is standard practice. Thoroughly clean drains and eliminate standing water and food debris and spilled garbage to prevent pest activity in this space. Now we've educated ourselves on some of the important cleaning and disinfection best practices and procedures, we can talk about how to reassure your staff, residents, and visitors as you begin to resume full operations. There are many ways to reassure your staff, residents, and visitors as you begin to resume full operations. You might prepare a message for your employees to share with residents and or visitors upon arrival. You might increase cleaning and disinfection frequency during high traffic periods to increase visibility of these tasks. You might add signage or queuing so residents and or visitors are aware of the expectations in common areas. And finally, consider giving residents and visitors the opportunity to provide feedback on the cleanliness of your operation to reinforce your commitment to their well-being. So thank you all for joining us on this very comprehensive webinar. I really enjoyed providing this information to you, and I hope you learned a lot. Now I'll turn it over to Alexis, where she will talk about COVID-19 response and recovery resources.
Great, thank you very much, Ben. So just really quickly, before we get into our Q&A, I just want to provide a quick overview here. I hope you found the information that we've shared today useful. We do have a number of resources available on our ecolab.com/coronavirus-LTC page. You can find information on COVID-19 kind of general overviews, cleaning procedures, as well as printable resources that you can post with reminders on hand hygiene and procedures. A lot of long-term care specific guidance for cleaning and disinfection, procedures, as well as resources specific to preparing to resume normal operations, including checklists, procedure guides, and some mobile-enabled employee training. And so you can see the link here. I believe it will also kick you out to that page at the conclusion of the webinar today. And that will also be the link that we will be sending out once this presentation and recording are available within sometime next week. So with that, I will open things up to questions. Remember that you can use the question function to type in any questions that you have. We will try to get to as many of them as possible here. And if we're not able to get to your question, we'll do our best to follow up separately. So I will start. It looks like we have one regarding kitchen sanitizing. So Ben, one of our attendees said that they currently use their quat from their 3-compartment sink to sanitize, specifically in their kitchen. She's asking if you recommend dual sanitizing. So do they need to take additional steps if they're using that quat from their 3-compartment sink?
So yeah, the quat from the 3-compartment sink does not have any claims against COVID, and so I think I wouldn't suggest a dual sanitizing. So disinfection, if we kind of jump back to what I had said about disinfection on food contact surfaces, we really only recommend that during kind of an outbreak. So if there's a known, kind of outbreak going on in your facility, I would say certainly implement a disinfection protocol to, those food contact surfaces. Just be sure that if you use a disinfectant to clean and disinfect those items, make sure you rinse it with potable water and then follow it up with that quat sanitizer, so that food contact safe sanitizer. That ensures that you're going to be in compliance with your food and health code.
Great, thank you. Shifting outside the kitchen but into the dining room, regarding disinfection there, we have a question around, specifically it says if we have an electrostatic sprayer, how often should we disinfect our kitchen and dining room? I think I would look at that question. I think regardless of what method you're using, the frequency, I don't think having an electrostatic sprayer would necessarily change that frequency, but Ben, can you speak to what frequency we would recommend in general for that, and if there are any specific considerations around electrostatic sprayers they should keep in mind?
Yeah, one thing to note right off the bat is when you're electrostatic spraying for disinfection, you're forgetting the step that you need to remove any soil. So if there's visible soil, you're not going to be able to disinfect at ahead of time. So we just want to make sure that we pre-clean the space before we use electrostatic spraying, if that's the option. And then two, as far as frequency, I think if we go back to, the slide that is kind of that graph, that little bit of a visual, there's no real concrete answer of how often you should do it. I mean, obviously, the more often, the better, but you really want to gauge it based on foot traffic and risk factors. So, whether or not there's an existing outbreak within the facility, then we want to make sure we step up and ramp up that frequency more. But I would say, best practice is to probably at least clean and disinfect those high touch points at least once per shift.
Great. Another question, can you speak to floors and the importance, what they should be doing with floors, and whether disinfecting floors is important?
So first I'll kind of revert you back to what your municipality has. If they do have some protocol requiring certain level of disinfection on floors, you want to make sure that you're in compliance with all of those local codes. However, disinfection of floors in general is not necessarily required, and that is mainly because if we think about a floor and how often in the transmission of COVID-19 is via hand transfer to a mucous membrane, example, eyes, nose, or mouth, the likelihood of somebody touching the floor and then touching their face is very low risk, and so therefore it's not necessarily required. So I would just mainly say that even though it's not required, I would use your best judgment and identify whether or not you feel as though you need to implement the disinfection program or protocol for your flooring, but it's not necessarily recommended.
I think another consideration specific to this space is just the number of residents that you have that may be using wheelchairs, where they do have wheels that are touching the floor, and then they're touching those wheels too, as another potential consideration.
That's excellent call, Alexis.
Great. Another question came in regarding dish machines and ability to kill the virus. So this attendee said that for long-term care, they're treating any new admits as possibly infected, which I think is certainly a responsible approach on that. So they're using paper products with any new move-ins. Is there anything that would say that dish machines kill the virus, and are they able to use regular dishes for potential COVID residents, or would you recommend paper products?
So short answer is I would say yes, if you have your dish machine set up correctly with proper products and cycle times and everything else. Much like the laundry room side of things, a dish machine is very effective at removing the risk of those pathogens through mechanical action, the water, the chemical action, and everything through the dish machine, making it inherently very low risk mode of transmission. Now, there's nothing, nowhere has the CDC, called out that this can actually kill the pathogen. However, it does reduce that risk significantly. But I would also like to point out, again, that from what we know is that, these items aren't really known to be high risk for mode of transmission to begin with. And so by running them through a dish machine and lowering that risk even further, I'd say it's a very, very low risk mode of transmission.
Absolutely. I think it would just be the keeping track of the collection of those dishes and the step between moving them between the resident to the dish machine would be the piece that you would want to make sure that you're being really careful about.
Yes, exactly.
Great. So building on that, also related to dish machines, if they're using a low temp dish machine, in order to achieve sanitization for COVID requirements, is QUAT at 100 parts per million enough?
So are we thinking at the 3-compartment sink is what I'm guessing, because typically in a low temp dish machine, using a chlorine-based sanitizer. In a 3-compartment sink, you would use the QUAT-based. Either way, again, the CDC is making a statement that, you know, this process of washing your dishes is a normal process, and as long as you're in compliance with, you know, the Food and Health Code, you're inherently lowering that risk significantly to the point where you should feel safe.
Great, thanks. Switching gears a bit, outside of the kitchen, we had a question come in around pools, and are the pool chemicals effective in stopping the transmission, or is it safe to open pools, or what considerations should people think about regarding their pools, whether they're for rehab or for more recreational purposes?
Yeah, and that's a great call, and I'd say for recreational purposes, you know, it's up to, you know, each facility and how they want to address the risk. Again, we'll go back into mode of transmissions on this, where this is not to be known as a mode of transmission for the disease. So therefore, it's a very low risk item. Now, we can't say the chemicals within the pool are effective at killing COVID-19 today. I would imagine that tomorrow might bring some more information and more light on this topic. However, what we do know is that it is a very low risk mode of transmission, so it's kind of identifying risk to benefit. If you need it for rehabilitation or everything else, it's one of those things where what we know today, it's just not a known cause for transmission of this disease.
Great. Well, I think that actually wraps up all of the questions that we've had come in at this point. So we may be able to wrap up a little bit early here. I want to thank you all again for the time and engagement today. I hope that you found this useful and that you will also use the resources at that long-term care resource library and find those useful in the future as well. If you do have any other questions, certainly recommend reaching out to your Ecolab representative who can help you with this. So thank you for your time today, and we very much appreciate it.
Thank you, everyone.